Let me start my 3-month progress report presentation with my PhD topic, which is New Frontiers in the Diagnosis and Management of Cutaneous Malignancies. I am Lili Gulyás, a medical doctor and a PhD student at the Department of Dermatology at Semmelweis University. I'm happy to share you my vision, which is improving the diagnosis and management of cutaneous malignancies. And to achieve this vision, my mission is to identify the most effective serum biomarkers and treatment options in these diseases. I have 2 ongoing projects, and let's talk about investigating the predictive value of different biomarkers for post-diagnostic events in cutaneous malignant melanoma, which I'm conducting with the methodology of a systemic review and meta-analysis. We can't ignore the fact that cutaneous malignant melanoma is the 5th most common malignancy, and every 1 out of 3 of all melanoma patients will have a disease recurrence after surgery and therapy. We can say that the 5-year survival can range between 98 to 22%, depending on the primary tumor stage. And unfortunately, in the clinical practice, there are no serological biomarkers available with relevant predictive value. Of course, there are biomarkers like LDH and S100B that we use in the clinical practice for disease monitoring, but they have low predictive value and specificity and sensitivity. And in the past few years, some novel biomarkers appeared with potentially higher predictive value. That's why our aim is to compare these serum biomarkers' predictive value in melanoma for disease monitoring to progression and patient survival. So our clinical question is which biomarkers have the highest predictive value of patient survival and progression in melanoma patients. We use the PO framework. We'd like to investigate in melanoma patients the levels of the serum biomarkers, whether they can predict the ability to predict our outcomes, which are death, disease progression, and patient survival. And we hypothesize that novel serum biomarkers have higher predictive value for the prediction of patient survival and progression. And the clinical implication is to find the most effective biomarkers for monitoring melanoma patients to improve patient survival and help therapeutic decisions. Here you can see my final search key, which contains 3 domains. In the first domain, you can see the disease itself. The second domain contains the serological biomarkers observed in malignant melanoma, and the third domain contains the outcomes, and this search was conducted in 3 databases. Here you can see some key articles related to LDH and other biomarkers like S100B and CRP. All of the articles investigates whether the biomarker levels can predict our outcomes, mainly patient survival data like progression-free survival and overall survival, and treatment response and progression. Here you can see key articles related to the novel serum biomarkers like circulating tumor DNA. All of the articles also observe LDH2, and these articles observes whether the circulating tumor DNA detectability can predict patient survival and therapy response in these patients. Here you can see the flowchart of the selection. In the beginning, I had more than 19,000 articles, and after the duplicate removals, I had 13,500 hits. And now I'm in the process of title abstract selection, which I'm conducting with Noemi Varga. And let's move on to my second topic, which is investigating the safety and efficacy of systemic therapies in locally advanced or metastatic basal cell carcinoma, which I'm conducting with the methodology of a systemic review and a meta-analysis also. We can say that basal cell carcinoma is the most common malignancy among Caucasian population. And there are surgical and non-surgical methods to cure this disease, but in some cases, these traditional treatment options are no longer feasible. And in these locally advanced and metastatic basal cell carcinoma patients can suffer from disfigurement, intracranial penetration, affecting not only the physical appearance of the patients, but also influencing their quality of life, psychological state, and even their life expectancy. For these locally advanced and metastatic basal cell carcinoma patients, there are some novel systemic therapies are available, for example, sonic hedgehog inhibitors and PD-1 inhibitors. Therefore, our aim is to assess the therapeutic efficacy and safety of systemic therapies in these patients. Our clinical question is, are PD-1 inhibitors effective for patients who fail to respond to sonic hedgehog inhibitor therapy? And the population is locally advanced basal cell carcinoma patients and metastatic basal cell carcinoma patients. And we'd like to compare PD-1 inhibitors to sonic hedgehog inhibitors in the field of efficacy and safety. And we hypothesize that in locally advanced and metastatic basal cell carcinoma patients, PD-1 inhibitors are an effective and safe therapeutic options after failure to sonic hedgehog inhibitors. And the clinical implication is to find the most effective systemic therapy for these patients after failing the first-line systemic treatment. Here you can see a preliminary search key, which I'm currently working on. This search was conducted in 3 databases. And to summarize my project, I have 2 ongoing projects now related to oncodermatology. The first is, investigating melanoma biomarkers, and the second is assessing the systemic therapies in locally advanced and metastatic basal cell carcinoma patients. And let me thank you for your kind attention, and I'd like to wish everyone a good afternoon with a quote from the great movie Star Wars: "Do or do not, there is no try." Thank you for your attention.
Do you know trigger factors or risk factors for locally advanced basal cell carcinoma? Because normally it's a surgically curable case.
Yeah, thank you for your question. I think immunosuppression is a triggering factor. We see it in mostly elderly patients, locally advanced and metastatic basal carcinoma.
Okay, thanks.
May I ask how often can we see metastatic basal cell carcinoma?
Yeah, it's a good question. Someone says that it's not an existing thing, but it's I don't know the exact number, but it's a very rare cases.
Thank you for your presentation. Regarding your second topic, what do you mean by safety as an outcome? So what would you like to evaluate here?
Okay, thank you for your question. We'd like to evaluate the adverse events, and yeah, so based on the adverse events by reported.
In your first project, how did you come up with the search key exactly? Because you have listed a bunch of novel biomarkers. How did you define or compile the list of novel biomarkers?
Thank you for your question. So first of all, I conducted a search with the second domain marker or biomarker, and I searched through the literature for serological biomarkers. And yeah, the novel, so I don't have an exact answer for this. We know S100B and LDH, and we use it in the clinic, but as I mentioned, their predictive value is questionable. So, yeah.
So the other ones were just based on the literature. You just found some that you thought. Okay.
Yeah, so, yeah.
Okay.
Congratulations for your presentation. My question is regarding your second project about the immunotherapy. Should you investigate the receptor positivity for those patients before starting the therapy?
Yeah. I guess we should, but so the articles often investigates it, but not in every case. So I guess that's a mistake. These are not reported.
Congrats to your presentation. I would like to ask regarding the first topic, if the articles and also you in your analysis plan to take account the treatment that patients are receiving. So if some predictive factors are associated with better prediction with some treatment or other treatment?
Yeah, we are considering it to do a subgroup analysis in the treatment, but first we'd like to do a subgroup analysis by the biomarkers and by the stages of the patients, but we are considering the treatments too.
Yeah, congratulations for the fantastic presentation. Yeah, my question would be that for the first project, you described that this project focuses on predictive biomarkers, but what is your take on diagnostic biomarkers of malignant melanoma?
Thank you for your question. First of all, we'd like to focus on serological biomarkers, and it would be hard to say that you can do a diagnosis from the blood or from liquid biopsies. There are some articles that investigate, for example, circulating tumor DNAs or microRNAs as diagnostic biomarkers in malignant melanoma, but these articles not observe the level of the biomarkers, but the patterns of the mutations or the specific microRNAs. So it wouldn't be comparable in this way in the field of diagnostics in the malignant melanoma.